Metastasis is a process where cancer cells break away from their original site and travel to other parts of the body, forming new tumors. This is a major reason why cancer can be so difficult to treat. Understanding how metastasis works is crucial for developing better therapies and improving patient outcomes. In this video, we'll walk through the metastatic cascade step by step to see how cancer cells manage to spread and survive in new environments. Let's begin by looking at the first stage of this complex journey. Metastatic cascade starts with local invasion. Here, cancer cells begin to break away from the primary tumor. They invade the surrounding tissue, pushing past normal boundaries. This step is possible because cancer cells often produce enzymes that break down the extracellular matrix, which normally keeps cells in place. By breaking through these barriers, cancer cells gain access to nearby blood vessels and lymphatic channels, setting the stage for further spread. After invading local tissues, cancer cells must enter the bloodstream or lymphatic system, a step called intravasation. This is a critical moment in the metastatic cascade. Cancer cells squeeze through the walls of blood vessels or lymphatics, often with the help of signals from surrounding cells and changes in their own structure. Once inside, they are carried throughout the body, but the journey is far from over. The bloodstream is a hostile environment, and many cancer cells do not survive this fate. Once in the circulation, cancer cells face many dangers. The immune system, physical forces, and lack of attachment can all destroy them. To survive, some cancer cells travel in clusters or attach to platelets, which help shield them from immune attack. Only a small fraction of circulating cancer cells make it to the next stage. This survival is a key bottleneck in the metastatic cascade, limiting the number of cells that can form new tumors. Next step is arrest at a distant site. Here, surviving cancer cells slow down and become trapped in the small blood vessels of distant organs such as the lungs, liver, or bones. This is often determined by blood flow patterns and the unique environment of each organ. The cells must then adhere to the vessel wall, preparing for the next stage of their journey. This arrest is a crucial checkpoint in the metastatic cascade. Extravasation is the process where cancer cells exit the blood vessels and enter the tissue of a new organ. This is a challenging step, as cells must break through the vessel wall and adapt to a completely different environment. Successful extravasation requires changes in cell behavior and communication with the surrounding tissue. Only those cells that manage to adapt can move on to establish new colonies. After extravasation, cancer cells begin to grow in the new tissue, forming small clusters called micrometastases. At this stage, the cells must survive in a foreign environment, often without the support they had in the original tumor. Many cells die, but those that survive can remain dormant for months or even years. Micrometastases are difficult to detect and can be the seeds for future tumor growth. Final step in the metastatic cascade is colonization. Here, micrometastases grow and develop their own blood supply, becoming larger secondary tumors. This process requires the cancer cells to adapt to the new environment, evade the immune system, and stimulate blood vessel growth. Colonization is what ultimately leads to the clinical detection of metastases and is often associated with a poorer prognosis for patients. To sum up, the metastatic cascade is a complex, multi-step process that allows cancer to spread from its original site to distant organs. Each step, local invasion, intravasation, survival in circulation, arrest, extravasation, micrometastasis formation, and colonization, presents unique challenges for cancer cells. Understanding these steps helps researchers and clinicians develop new strategies to prevent and treat metastatic disease, offering hope for better outcomes in the future.